Hello, 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 hello. Happy Tuesday. Happy Tuesday to all my ATH Ellers. Welcome back. I'm welcoming back. Hello. For those of you who don't know me yet, my name is Abby Tyler. I am a practicing family nurse practitioner, community health volunteer, and content creator. I haven't been here for about 2 weeks now, so I'm back. I miss you guys when I was gone. I was on vacation. I had a good time. I feel well rested, even though I want to go back. So before I start, let me start by saying happy June. Happy birthday to everybody celebrating their birthday in the month of June. Happy graduation, happy wedding, engagement, and everything. We start. Happy birthday to you. Happy birthday to you. Happy birthday, happy birthday, happy birthday to you. So I'm going to be making sure that I'm on my other channel there. So let me just give me a few seconds here. So I was on my vacation. My family and I went to my niece's wedding. We kind of just made it our vacation because we hadn't been on the vacation for so long. So far, we're on our vacation, and also my son graduated too. So we put everything together, and we're in a beautiful Punta Cana, Dominican Republic. It was fun. I hope you guys get to go on your vacation soon. So just give me 1 second here. Well, not actually 1 second, but I'm just gonna make sure I am on live because my internet is probably acting up today. So just want to make sure that I am on. 1 second here. Okay, so I am actually on. I am going to share the show. Please, for those of you who are watching too, if you can share the show, I would greatly appreciate it. And I'm going to go there one more time. And we'll go here. Mm-mm-mm-mm. Mm-mm-mm-mm. Okay. Okay. So I hope my internet's acting up. If not, I'll just record it and then put it back on. But anyways, I am back. As you can see, the show today is if you're traveling for vacation. I always go on my vacation and being a clinician, I was like all the many things that you need to take care of prior to going, and also for the fact that I have patients who come to see me and they're going on vacation, so I have to make sure that everything health wise is put in place before they leave, regardless of whether you're traveling next door, whether you're traveling somewhere in your state or overseas. You want to make sure that you have these things. Now, sometimes some people will say, well, I've been traveling for a while and nothing has happened. You just try to scare me and this and that. You're trying to make it some place look like it's not decent for me to travel. Not at all, not at all. Because again, what as we tell you people, as we tell our patients and everything, you come to your doctor, your provider to ask any questions about traveling anywhere else, what I need to do to travel. We can give you all the advice and all that. In the end, you're going to have to make that decision on your own. The only thing we can do is advise you on the kind of things to keep you healthy while you're there. The decision is totally up to you whether you choose to do so or not. Okay. So we're not here to scare anybody. The same with if you were going somewhere and the State Department was saying, America doesn't have a diplomatic relationship with this place, or this place is not safe enough to go there. And even your travel agency, they might say, okay, certain places when you can't go there right now because of this and that. This is all. So being in the position that I'm in, I'm just giving this as a service, community service to you. Okay, so without further ado, let's get right into it. I'm going to be reading again from my screen. So 1 second here. Okay, so these are just essential. It's not comprehensive, so you still have to speak to your doctor. Again, my disclaimer: whatever I say here shouldn't take a place of you going to see your family doctor or provider and making sure you get information that is personally for you. Okay, so you're traveling somewhere, chronic diseases or emergencies don't take a break. So you want to make sure when you go in there, you're prepared. Okay, so we'll start with medications. You want to make sure you have enough medications when you travel. Okay, that you have, especially your blood pressure medicine, your diabetic medicine, things like your asthma medicine, especially your rescue inhaler. You want to make sure you have all those different things and have enough. If you plan your vacation during a time where it's not time yet for you to get your medications renewed, you can always ask your doctor and say, I'm going to be traveling. I know I'm not due for my refills yet. Is there a way that you can give me extra refills so that way I can have enough medicine because I'm going to be traveling overseas, or I'm going to be traveling away from here and I may not be able to reach the office. It may be on a Friday, on a Saturday, Friday evening. And if I call you, you may not get back to me. And it's something important, especially like I said, things like your insulin, your rescue inhaler for your asthma, any kind of medication that has to do with your nerves and all. So you want to make sure you have that. So make sure you talk to you. If you plan on going anywhere, you're going to be talking to your doctor with I'm going somewhere. So make sure you have that conversation with your doctor. Go in and have that conversation or call and ask them what it is that you need to carry. Okay, ask your doctor, like I said, probably in advance. Also, ask your travel agency and also about the place you're going. If you go in there, what kind of medications are you allowed to carry on the plane? Because there's certain medications that you're not allowed to travel with. There's certain places where you can travel with narcotics. But what if you're taking pain medicine for sleep? What if you're taking pain medicine for sleep? Pain medicine for pain, if it's a narcotic. What if you're taking something for sleep? That's also a narcotic. If you're taking something for, like, let's say behavior issues and all, those are, and if it's narcotic drug control medications, meaning that the narcotics and they have to be written differently, you want to make sure that you talk to your travel agency and see if you're having any problems traveling and what it is that you have to write disclaimer and all that. If your doctor has to write a disclaimer and get extra, because if they look in your bag and see a bag of Lexus Xanax or something there, that could be a problem for you. You don't want anything that's going to delay your flight or cause you to have any problems. So make sure you check with your doctor first. And if you're traveling to a country that has pharmacies, you want to make sure you ask your doctor if you need to call in a medication. Is it a pharmacy that can be trusted, not so much trusted, but like accredited and all that? Because if we're calling medication into places where it's not like accredited pharmacy, and if you're calling and you don't have the medication and you wait and you get there and we're calling and there's problem with email, there's problem with the phone lines and everything, that could cause a problem. So you want to check ahead of time. Are you traveling to somewhere that have accredited pharmacies? Or you have places that, and you want to get the medication that's contained, not something that's in bottles that's not labeled. If it's bottled, it's got to be labeled and everything. So you got to make sure that those pharmacies, the places that you're going, you have pharmacies there. And how close is the pharmacy from where you're going to be? If you're going to be at a resort, do they have an infirmary there where they have the pharmacy? How far is the resort from where you are? If you go into a small city that's far away from town, how soon can you get to that city to get your medication? All those things you want to be thinking about. Okay. Again, like I told you, you want to make sure. And also, if you go, are you traveling to somewhere that has that have reliable electricity? Because there are some medications that need to be refrigerated when you're not using it. Okay, because if it's reducing the potency of the medication, or and causing medication, sometimes medication chemical components and all that, it can become to where it becomes poisonous. So you don't want to have something where that should be refrigerated and it's not. So is it reliable refrigeration? Can you ask your doctor if you can take any other medication during the time you're there, that you don't have to take that medication because somewhere where you go in is not reliable electricity? Or how it is that you're getting your own electricity? Do they have generators and all those things that you go in? Have that in mind when you go in. Not discouraging anybody from going anywhere, even if you will go into somewhere in America, somewhere like that. If you stop in the hotel, yes, we have reliable electricity and all, but you would just, like I said, if you're traveling to different places that don't have that, check that first. And if they don't have reliable electricity, how are you planning on getting electricity? Make sure your medication is safe, because everybody wants to go have a good time. Just because you have a disease, a chronic disease, a disease that needs to be managed with medication, daily medication, doesn't mean you cannot go to go have fun. But you want to keep yourself safe. Same way, if you're going somewhere where the security was bad, they would tell you how to keep yourself safe when you go. Okay, all right. The next one, in hospitals. You want to know what the nearest hospital is to where you're going to be staying. If you go into a resort, and again, you go into a resort, you go into a hotel, you go into a small town, you go into a major city, wherever it is, you ask them, where's the nearest hospital here? You also want to check that hospital, do they cater to children? Do they have children? Because the hospital I worked at before, they take care of children in the emergency room, and then they ship them, if they have to, they ship them over to the children's hospital when they're stabilized. Yeah, I had one that was like maybe 10 minutes down the street from where I worked, and then they had to send them to the major one in the center city. So you want to check and say, okay, in the emergency room, after my child stabilized, where is the nearest children's hospital? It's not that people in this hospital that can't take care of children. It's just that because that's not what they do all the time. So they get the child stabilized. You want to go somewhere where they do things all the time, where you become more specialized in taking care of certain things. So they want to send them to the children's hospital, because when children in the hospital and the parents are not everything you need, even that child's like 17 years old, you still have to call the parents for everything you have to do. And there's so many different guidelines, and there's so many child abuse issues, there's so many different clearances that everybody has to have when you run a children's hospital, when you're taking care of children, that they can't be in a room with somebody else and all. So that's why you have different places where you have children's hospital, children can go to there. And if they have a pediatric floor, also those nurses are also trained, and everybody else who cater to those children are trained in there. Everybody gets child abuse clearance regardless, but they have specialty training for that, for taking care of children. Okay, again, like I said, I'm a family nurse practitioner. I can take care of children, but at a certain age, I prefer for them to see the pediatrician and then can come to me later on. Okay, so make sure do they have ambulance system there? I mean, if something happening and you're 30 minutes away from the hospital, you call 911, or do they have emergency response system? Are you going to be putting them in a car and driving them to the hospital? A simple asthmatic attack, if not taken care of and quickly, simple, and I mean it's simple because asthma is really serious too if it's not managed well. And also like heart attacks, strokes, and all those different things. You want to be able to want to make sure that they have an ambulance service there so they can go, and not just people who just put you in the ambulance. You want to make sure that they put in needle and you put in IV access, they give you emergency drugs, and they're calling the hospital saying when they have to be there, and everything that has to go on to give you greater potential saving your life. It's not okay. Yes, why people die in developed countries too. People die at different places. The chances of you dying when everything is in place is greatly decreased. Not saying everything is perfect, but if somebody told you you had all these things and would keep you safe, will you say, oh no, I'm just going to take my chances? No. So make sure, when you go in those places, just ask when you get to the hotel, when you get there, or you stop in a family member's house, and just say, is anybody, how far is the hospital from here? How do you get to the hospital? Any kind of emergency route, find out from that. Okay. Children, like I say, if you're traveling with children, make sure you have a brief summary of their illnesses. Usually when they're like that young, they don't have that much. You can have it on your phone, like you have secret apps so you can have all that information. I really hope my internet is behaving because I'm looking at the screen. Okay, things like their allergies. You want to make sure you have all their asthma medicine, their EpiPens, because you can go somewhere and have like a severe, like a bug bite, a severe allergic reaction that you need to give them the EpiPen right away to save their lives before going to the hospital. You want to have that. Again, make sure you know what the hospital is that treat children. If you have children that have anxiety issues, or have anxiety issues, depression issues, also flying in planes, and you have people who have children who are on the spectrum like autism, and depends on where they're high functioning, that's fine. But they have issues where when you put them in closed places, they become very anxious. Even with adults, when if you're claustrophobic, you're in the plane and so many people around you, and you have to stay seated for a long period of time, and you have your seatbelt on, you can't move around. If you have small children, you have to tell them this is what's going to be happening. Make sure you take their games with them, take the dolls and everything to keep them, because if you're going on a long flight, let's say you're driving overseas, so that's it's a light area, you're going for over 5 hours, and if it's not like a straight flight, you're still going to be flying for a long time, over 4 hours, before they land again somewhere, before you take another plane. So you want to get that straightened up, and make, and they're going to cry, but at least that way you put everything in place to keep them safe, and that way you don't feel overwhelmed that they're disturbing the other passengers, and also for them too, because you want to make sure that they're comfortable going to this trip that everybody's so happy to go on, but their brain's not going to be saying, oh my God, I'm so excited to go in this. It's just that some people be in a quiet place. And the younger they are, they're not just going to sit still for a long time. So take everything with them and tell them in comfort, and let them know that this is going to be a long ride. And as soon as the captain says we can take our seatbelt off, we'll take it off, and we'll walk around and all, but we can't run around like we do when we're not in the plane. Okay. And this is something you want to be telling them, and of course tell them over and over again, because they're not going to understand it completely until you're in a plane and you're sitting there an hour later. You still have to be seated straight, especially when going to turbulence. You want to, they have to sit still. Okay, wash your kids when you're there, wherever it is you're traveling to. Wash your kids, because there are a lot of people who go into these trips and all that, to like huge child trafficking all over the world. Where we stayed, the hotel guests, they had two different places where the guests that had children were somewhere else, and even though the same resort, but they in this different spot, and everybody else on the other spot. People came together. That's what they also told you when you got there. Even though we're two different places, that the other people cannot book rooms in this place, but they're still going to be talking together because they're still, you're going to be going to the beach, they're still going to be going to the cafeteria or the buffet in the different restaurants together. So you want to make sure you keep an eye on your kids at all times, because it, like, again, like I say, it takes a very few seconds to just walk away with that child and be gone forever. Okay, so keep an eye on your children. Elderly, if you go to you go and traveling with the elderly people, make sure they have their canes and their walkers, they have all their medications, their glasses, their hearing aids, their dentures. You don't want to take my mom or pop up somewhere and then they're not enjoying their food because you forgot their dentures, or they can't go somewhere because you forgot their wheelchair, and you've and call the traveling agency and say what are the amenities that they have for me to take my mom or my dad somewhere. Call the airline also when you get there. They have people who help to take elderly in and out of the plane. That when I was there, I saw that. Even when you go to other airports, find out what amenities for people who are handicapped and go there, because also you don't want your elderly parent falling in a foreign land, even if it's their homeland, falling there, and let's say they live over here and falling over there and suffer a severe injury and then have to be in the hospital, especially if let's say somewhere else in a strange country where they don't speak the language. Elderly people, they have a hard time adapting into a regular hospital anyways, because they have just a different scenery, especially if they're much more elderly. And then you imagine you put them in a place where there's like, and they don't speak the same language, and you're in and out, you're not allowed to come in, and with COVID and restrictions still going on in different countries. So make sure you do all that to keep them safe. Make sure you keep them hydrated. Also make sure they take their medicine, because, like, again, chronic illnesses and emergencies don't take a break simply because you went on vacation. Okay, let me go here. Alrighty, insurance. Health insurance. Just 1 second here. Let me just take a sip of water. Health insurance. You want to check with your insurance provider. Okay. Most insurance do not cover you if you go overseas, or I don't even know if it probably covers you in the continental US, but they don't cover you if you go overseas. So, and you don't want to be there and thinking that if something happens, I'm going to call Blue Cross Blue Shield or Keystone Health Plan East or do no, it doesn't happen that way. You want to make sure you call your provider and say, okay, we don't cover it, and you call your traveling agencies and they can give you options on different insurance company. It's not that expensive. I mean, so you just says, okay, even if it's a little bit over, just ask if you, I mean, especially if you travel in a group and all, it won't be that expensive. So you just put in that, you can say, oh no, I'm just going to take my chances. Yes, you can take your chances, but again, you're going to be in the strange country, you're going to be in the hospital, and some countries, they don't see you, they won't take care of you unless if you have in the kind of, some hospital won't take care of you if you have cash, regardless of the emergencies or not. So make sure you have some cash on you, and then also you want to have insurance because you'll be there. And what if you have to stay there until they can bring you back to America? Okay, or back to wherever it is that you live that's away from your home, and you have to pay for the flight, and also make sure you have health insurance, pay for that. Find out what it covers, and all, if it covers like air flight back, or they can take you to the nearest hospital, nearest area, and the nearest country where it's safe for you to get insurance. Go ahead and do that, but again, it's up to you. But I will suggest that you do that, especially even if you don't have chronic illnesses. Anything can happen, and guess what? All that money you're gonna have to cough it up before leaving that country, because you don't know what the country's rules are when they're saying, "Oh yeah, I'll pay you when I'll send my money when I come back," because they know most people won't pay them any more money once you leave the country. That's it. So I don't know. I don't know what their rules are. Some people will literally, some countries would literally hold you in the hospital until you pay them money. So have that with you and check it out, see what everything that it offers, and go from there. Okay. Like I said, you can, take your chances, rely on a higher power, but higher power, I see the Pope, I see all the people who I've taken care of, who's been in the highest of religion and all, they also have health insurance, and they do that, and they still believe in God. So you can do both. Right. Go into dermatology, allergic reactions. Again, I'm one of those people who, we went to the hotel. It was nice, luxurious, and I have fun. I did not use the soap. I did not use the lotion, mainly because I have sensitive skin, and I don't want to use anything that is not, my skin is not used to. And then I come back to America, and then I have a rash, and it's like, oh my goodness, what's up with that? You don't, you have no You have no and what kind of medication did you use, what kind of lotion did you use, what kind of detergent you used while you were there, even rubbing against the sheets when you're there. I mean, I didn't take my own sheets, but it's just, you could get in something. So if you don't have to use the lotion, don't use the lotion. If you don't have to use the soap, don't use the soap. I mean, you can take it for souvenir and all, because they're going to throw it out anyways, but don't use it if you don't have to. Now it's up to you. Before I used to use it before, but now it's like, you know what, I don't want to, because I don't. And I see my patients are like, "Oh, did you travel recently? Did you change lotions? Did you change detergent? Did you change?" So at least you want to know what it is that you use if you went to your doctor's office. So if we're going to ask you that question, did you travel recently? Also, so you can have the really bad rash that can last for a long time. And most of us, we go for vacations, but when we come back a couple of days or 3 days later, we have to back to work. So you don't want to, especially if you didn't take enough time off work or you don't have enough time left, you don't want to run into problems like that. So don't use it if you don't have to. Okay. And also make sure you go to your doctor, and also different organic fruits. When you buy fruits like from the side of the road and all, you say, "Oh my God, I see their fruit is so nice and it's from the soil." If your body's not used to it, don't do it. If your body's not used to you drinking the water over there, don't drink the water over there. Make sure you know where you're eating, to whose house you're eating at. If you're eating at a friend's house, make sure you're eating, because it's like how they prepare the food, all of that. If you start having severe diarrhea and all, you're not going to be getting on that plane. Okay, because especially if that plane ride is long, and if you more longer diarrhea, you're going to become dehydrated. You're going to start having problems breathing. You're going to have problem with your heart, because the body cannot take when it becomes severely dehydrated, and it starts going after your major organs. So if you have one of those people who have weak stomach, or it's not something that I would tell you to do, because even now they're not allowing you to bring in a fruit in the country that's not packaged and for sale or for something else, and it has to be processed separately. Okay, if you don't bring in medicine and food in your bag either, because they find out, you could get in trouble. All right, because we had to go to customs and they tell you do not bring anything. Even at the airport over there, they were saying do not take anything that's fresh fruit, outside the country. Eat it, but it's up to you. I would suggest don't, but that's up to you. You know your stomach, you know everything that you're doing, you know what your job is and what you can afford to stay home for a longer time. That's up to you. This is just my advice. Okay. And prior to going, you want to visit your doctor, speak candidly about everything going on. Say, "Doc, I have this issue, I have that issue, my illnesses, everything that I'm dealing with. Do you think it's a good idea for me to go?" You'll be like, "Okay, yes, okay, let's see where you're going. What do you know about the place that you're going to? What is it?" Everything that I spoke about, speak clearly, be candid about it. And like, in the end, they'll tell you what it is, and then you can make your own decision. Like I said, nobody's going to scare you or go anywhere. It's the way if you're talking to somebody who's in security detail, like a police person over here, will say, "I probably won't stop at that place because that place has no security there." You wouldn't say, "Oh, forget it. Don't scare me. I'm just going to do this." No, you will listen to them and say, "Okay, I'll make sure I'll take all necessary precautions. This is what I'm talking about here." Okay. And also, if you go in somewhere with children, you're leaving things behind, make sure you have a will, because if anything happens to you while you're over there, let's say you went without your kids, your family members over here, your friends over there will be responsible for taking care of your kids and taking care of your belongings and your wealth and your everything else. You may just have two pennies to rub together, but they have to make sure your children are safe, and things are put in place in case anything happens. Even in case anything happens to you there and you all come back, they have to bring you back here. Put somebody in charge. Make sure they know about your life insurance. You don't have to tell them all the details, because all you have to know is just the insurance company, and they can just call it something like that. So make sure, "I'm leaving. This is my house." If you have any pets, you make sure you're putting your pets away. We used to put our dog in the dog hotel, because we have family members that take care of dogs. Taking care of dog is a big deal. It's not something where you just put outside in the yard. So you want to do that. If you have birds, make sure you have two birds, so had enough food for them to take care of themselves while they were there. Make sure people keep an eye on your house. Just pass my house once in a while. If they have to take out your mail, take out your mail, because you don't want your mail to be in there and it's there for a long time. People will know that you're not home. All right. Make sure you take your safety kit, first aid kit. I went over my first aid kit last time. Look down my other couple of videos below. I did first aid kit. Make sure all your medications are up to date in the first aid kit. You don't want to be taking loperamide, Imodium for diarrhea, and it's like being expired 2 or 3 years ago. That's not going to work, and you could really cause some problems, some damages if you're taking medications that are expired. Okay, so making sure you have your insect repellent, because you may go somewhere that have a lot of mosquitoes also. A lot of mosquitoes in America anyways, but you have that. Make sure you take enough water, stay dehydrated. If you have to drink, if you have to have some ice over there, Make sure you ask that, because the water could be bottled water, but the ice could be tap water. So again, watch for your stomach. Don't drink too much alcohol. Making sure if you're drinking that people are around, because if you drink too much alcohol and you become drunk, you could have make some unsafe decisions. We know all of that. They don't want to come back, expecting a baby, or making somebody pregnant, or doing all those different things, or driving drunk in a strange country, because some countries don't have strict driving laws. So you go there and do that, you could cause, your life to end, or somebody else, a loved one. So don't do that. If you're going to drink heavy, and somebody's around, somebody's driving you home, that person should be drinking as much too. And then you guys can go from there. So and then if like I said again, this list is not conclusive. It's not something where it's comprehensive, where you can say she didn't say this one, she didn't say that one. But make sure, and when you come back, if you start having diarrhea, stomach pain, and it continues for a couple of days, make sure you call your doctor and be honest that yes, you went traveling, because there are different kind of medications that we do for different kind of diarrhea. And any kind of rash, go to the doctor's office right away, and we'll call first, and then let them see you, because whatever it is that you're taking, you may need some antibiotic, you may need something else that's causing it, or it may be something severely that you need to be seen in a hospital for. Okay, so make sure you do that and take care of yourself. You can go to CDC website, your hospital website, and just see different. Okay, I want to see everything that I need to travel health wise, and go on from there. You know your body, you know everything, your children's history, you know everything about yourself. You're going to make that decision based on the information, and please make wise decision. If you have to travel, sometimes you may just travel for a short period of time. It doesn't have to be long, because you have chronic diseases that you need to be close by, where you have reliable hospitals and your doctors and everything close by. Make a short vacation, make several short vacations. It doesn't have to be going for a month, but you can't afford to be away for a month because of your health problems. Okay, so again, that's all I have to say. I didn't even make this long, but apparently I went up like 25, 26 minutes. But so for those of you who are not on my who frequent YouTube, I'm on there. I'm on Twitter also. Please subscribe to my channel. Don't want to make this long. My second day back at work, and I just feel like I need to be back there, where I'm like laying on the beach and just having a good time. So I hope you all are planning on having vacations. For some of you already have vacations earlier this year, and summertime is safe. Please be safe. Please be safe. Watch this video, share the video, please, as much as possible. And I stayed over, like I said, I was over at hotels Zalara and Ziva in Punta Cana, Dominican Republic. It was really good. I was asking, I said, "You looking for a nurse practitioner?" I was trying my Spanish a little bit. Oh God, I hope I didn't say anything wrong, because it didn't look at me like I was saying something wrong. So, you know, but as they say over there, like they always put a hand on their heart, and they be like, buenos dias, buenas noches, and all that. So it's more like, talking from the heart. So by the end of the vacation, I was saying that too. So all my ATHLers, thank you for watching. Please share the video. I will be back on a Friday with Friday Chat with Abby. I hope you all stay safe. Thank you for all your love and support over the years. I mean, just see here. Oh, I was just forgetting. Oh my! Oh, welcome back, Abby Tyler. Thank you, Jackie Jackson. And what you say? Oh, you are glowing. Yeah, yeah, it's all from that, from that nice ocean, tropical stuff there. So, but thank you all so much for all your love and support over the years. I really appreciate it. And I hope what I said here today has helped or will help somebody. Again, watch the kids and just go back, and I want to get long and summarizing. So. Thank you all for your love and support over the years. I thank you also very much from my heart to yours. It's just buenas noches. So anyway, good night. God bless. And I'll see you guys on Friday for Friday Chat with Abby. Okay. Thank you. Bye-bye.